I'm Dr. Darrell Kirch, and I have the honor of serving as President and CEO of the Association of American Medical Colleges. It's interesting, we're sitting here today in the AAMC's building, which is about 6 blocks from the White House and 6 blocks from Capitol Hill. And that reflects the fact that a lot of what we do on behalf of the medical schools and the teaching hospitals in the United States is work to advocate for them. In academic health centers, it is the only place in the nation in which these 3 key public goods, educating the health professions workforce, developing the science to move healthcare forward, and taking care of patients, all come together. That's very special. I grew up in Denver. My parents were incredibly hardworking people who hadn't really had the benefit of much education. They instilled the value of higher education in me. I had no idea what career I might pursue, but when I came to the decision to go to medical school, I've never looked back. And then it was total serendipity that a colleague suggested I might allow him to nominate me to be the dean of a medical school.
Darrell's and my paths first crossed 25 years ago when he was interviewing for the deanship at the Medical College of Georgia. He was smart, articulate. He was well trained clinically in psychiatry, had a rich research background from his years at the NIH, and didn't know diddly about medical education. I hoped he would become my dean, and he did.
Darrell Kirch and I crisscrossed along our career many times. It was not till about 3 years ago when we worked closely together on this issue of clinician burnout resilience when I got to really know him. He was the one who lit the fire, and I think many people are aware of this, but I think it was his idea that we at National Academy of Medicine can be helpful to them.
Watching him in action, knowing what he stands for, reading the things that he's written, it gives everyone, I think, a very strong impression about what the standards of our profession, particularly academic medicine, aspire towards. And I think that's been, one of the most vivid examples of his leadership.
When I first heard that UMass Medical School would be honoring Darrell with an honorary degree, I was just absolutely delighted, feeling as if he richly deserves that honor. And quite honestly, I thought it reflected well on UMass Medical School to choose him to receive it.
Kudos to UMass, recognizing that Darrell Kirch has made this contribution. Because selfishly, I said, being a 2015 honorary degree recipient, I'm in good company.
When I learned not only that I was being invited to be a commencement speaker, but that I was getting the incredible honor of receiving an honorary degree, it just was humbling and wonderful news.